It's okay.
I keep getting kicked off. I'm really sorry. It's a good job I've got some backup. I've let everybody in now from the waiting room, so if we can please make a start. And I think we're being recorded. I did press the record button before I was thrown off yet. Thank you. So next slide, please. It's hopefully going to be a fairly short meeting today. So we've got Steve Turnbull giving the COVID update. I think Sarah will be next actually about the vaccine and winter wellness from Emma, but we'll sort that as we go along.
Okay, so shall I talk through these slides? There's the usual caveats which we share at the start of every one of these discussions. If you move to the next slide, please. And you'll notice the date on here at the top says 5th of December. It's actually not. It's actually the 3rd of January. So the slides have been updated, just not the headline. And what you can see on there, these are the regional breakdowns. Oh, John's not seen anything. Is everybody else seen the slides?
Yeah, can see them.
Okay, great, thank you. Not sure what the issue you've got, John, but maybe try rejoining. I'm wondering whether that might work.
Yeah.
All right. So as you can see, pretty much every region had a rise during late December into January, and it looks like we're all now coming down from that peak. So we did have an increase as predicted, but it wasn't as high as we feared. So that's really helpful. The Yorkshire Humber position currently is about 4%. That was a couple of weeks ago when we had the last data update. We feel like we've come down a bit since then as well. So that's all really helpful. If you move to the next slide, you'll see the breakdown in age range. And again, fairly consistent coming down. Younger people have kind of leveled off. Middle ages are coming down. The one slightly worrying thing is just the 70 and above are still fairly high, but we're hopeful that will start to come down as well. If we move to the next slide, this is just another way of measuring it, which is a bit better currently, which is just patients with COVID in a mid-Yorkshire hospital bed. Dark blue line is the bars of the Wakefield patients, and then other patients on top of that. So, and again, you can see those consistent waves that we experience time and again. And the last wave is no different, slightly less than the previous one. And we're now coming down off that, and the position in the hospital still pressured, as you would imagine, but certainly improving. It's probably worth. I'll just move on to the next slide, which is just the death slide, where you can see the small numbers of deaths that we keep having due to COVID. Again, that's far lower than it has been, and it actually is still progressing in the right direction. I'll just add a couple of extra comments on COVID, and then mention a few other things. So it is coming down. It's coming down quite well nationally, by the sounds of it. You'll have heard lots of things about different variants. They are all subtypes of Omicron. So we're still dealing with Omicron, but they've just got little differences in between the different types. The one that's growing, becoming more dominant at the minute, is one called XBB 1.5, which is not the most user-friendly name, but that's what we're stuck with for now. That's becoming dominant. That might cause another little wave sometime in the spring. So we'll start to see what that comes like. It's not behaving like a new variant. It's not causing any more serious disease. It's just a little bit of a change, and possibly a little bit more transmissible than what we've been dealing with so far. One thing that we're less clear on is what's happening in China. You'll see China's had a huge amount of COVID recently. We've got Chinese New Year coming up next week. That may again help to cause another spike, but we'll just see what comes of that. The other things that have been causing pressures in terms of health protection, flu, influenza went up really high and really rapidly. It's now coming down, which is really good, and it did what we were thinking it might do. It went up earlier and higher and faster than normal, largely in younger age groups. That's what happened in the southern hemisphere. It's now heading the right direction, and current thinking is that's probably going to be the main issue with flu, and we hopefully won't get another spike. There's some other, the other one that people have been worried about is strep A and eye gas and scarlet fever, and again that's heading the right direction. Again, that does have the potential to have a second wave later in the winter, but hopefully for now that's going the right direction as well. So that's it for my health protection update. I'll pause there.
That's
Tracy.
great. Thank you. Does anyone have any questions for Steve, please? No? Well, we did have some questions that were previously submitted. I think they might be on the next slide. And I think you and Sarah might be able to answer these together. The first one was from a couple who said they've missed the winter boosters. So could they have them in the spring? And is there a deadline to have them? So we'll respond to that one first.
I'll let Sarah respond to that. Be on mute, Sarah.
You're mute, Sarah. Oh.
Sorry, I don't use Zoom very often. That's my excuse. I'm Sarah Akers. I'm the COVID vaccination programme lead for Wakefield. So at the moment, we are still giving people boosters who are eligible to have one this season. At the moment, we don't even know for sure that there will be spring boosters, although we suspect that JCVI will ask us to offer those to people. However, the spring booster is likely, if they do run it, to be offered to people who are over 75 or in care homes. So it may be the case, depending on this couple's age, that they don't qualify for it. We'd strongly encourage people, if they have not yet got round to booking it or to walking in and getting their vaccination, to go and get it soon, because what we're seeing is, with lower uptake at the moment, it's possible that JCVI will say, yes, do a spring booster, but actually pause now and have a break before we then do that. Because what JCVI are wanting is, longer term, they're wanting this to become a seasonal programme. So it may be that there's a spring booster for the elderly, and then for everybody maybe over 50 or over 65, there's an autumn booster that comes out around the same time as flu. We'd strongly encourage people to try and get themselves into a bit of a routine where, if you're eligible for an autumn booster, you go and get it when everyone else is getting theirs. And then the same, if you're eligible for a spring booster, get it at the same time as the other people in your age group. That will make it easier for you to make sure that you do get it, because it may be that we pause and we don't have lots of clinics running.
Oh, that's really useful to know. Thank you very much, Sarah. So the second question we had submitted was from someone who said they understood we have a large number of people having heart attacks across the world, which is not being reported in the mainstream media. Is there a connection between COVID-19 or the COVID-19 vaccinations?
Do you want me to start on that, Sarah? Then you can
start on there.
Yeah. Okay. So I suppose the first thing to say is cardiovascular disease, which obviously includes heart attacks, is one of the main causes of death and illness across the world currently, certainly for non-communicable diseases, so not something that's infectious. So there's already a large number of people affected by that. And if you think about what causes cardiovascular illness, then there's a number of different factors in that. So anything from stress, either chronic stress or acute stress, and those kind of health behaviors in terms of things like alcohol use, obesity, smoking, obviously is a key factor. So there's many different causes of cardiovascular disease and heart attacks. And has it changed since COVID? Yes, I think that there's probably been more cardiovascular illnesses. Why is that? Could it be something to do with the virus? Yes, it could, but it's also to do with all those other factors as well. One of the reasons why pandemics have always been at the highest level of risk for the national government and the National Risk Register is it affects all of our lives. As we see, pandemics change the course of history. So it's more complicated than just saying the virus has caused heart disease. it's caused changes to the way we live that may mean some people are more at risk of heart disease. So we know that a lot of people have suffered with mental health and stress and anxiety because of lockdowns and the whole stress of living through a pandemic era. Plus, we know health behaviours changed. Some people became far more sedentary. Some people may have used alcohol more. We saw in the data around children that following the lockdowns and schools closing, children's weight increased. Thankfully, it started to come down the other way. So there's numerous different factors that can cause cardiovascular illness and heart attacks. The one thing I'm really clear about is this is not a thing we're seeing in the COVID vaccine. We do know rare occurrences of adverse reactions to the vaccine, but by and large, it is overwhelmingly a positive thing for the population as a whole, and has reduced the number of severe illnesses, episodes that we've seen, both directly from COVID, but also the other broader adverse reactions. So it's certainly nothing to do with the vaccine. And beyond cardiovascular disease, we're also seeing excess deaths from all kinds. The information is publicly available, so whether I think Tracy's just left. So, oh no, you're still there.
Sorry,
Yeah,
I did leave. I keep
That's
getting
okay.
kicked out. Come back.
Yeah, no, that's
Sorry.
fine. So as long as people can still hear me, and so I think so and the causes for that excess death is something that's been investigated nationally. Again, it won't just be around the virus and the reaction to it. It's also about the changes in care and the stress that the whole healthcare system has been under over the last year as well. Will possibly play a part in that. So complicated picture. I'm hoping that I've answered that, but happy to come back and talk more.
Thank you. It answered it for me, so thank you very much. I don't think the person's on to ask a question, actually. But everybody gets a copy of the recording, Steve, so thank you for that. Sarah, did you want to ask anything? Sorry, to add anything to that?
No, just to confirm that I think Steve's had a really good explanation there about the sorts of issues and the sorts of pressures. And as Steve says, a pandemic isn't just about the illness itself. It's about how fit you are to cope when you've suddenly got something else that's enormous that the NHS has to deal with. And it's had a knock-on effect on all kinds of things like cancer rates. I'm not sure that actually isn't being reported in the mainstream media either. What I'm going to do is I'm going to put something in the chat, which is a really good kind of layman's summary of those sorts of issues by the BBC, which might be interesting for people to take away and read.
Yeah, brilliant.
I read it and I thought that explains things much more concisely than I ever could.
Brilliant. Thank you very much. And I think, Sarah, I'd put you on next because I thought you might be able to answer those questions. So could we have the next slide, please?
Yeah, so what I haven't done is produce a slide deck with lots of data, which I often do, because we've effectively now closed our main autumn campaign of COVID boosters. And that pretty much coincides with when everyone else also had a chance to take up their flu booster. So I'll just give you a couple of figures, which I think might be interesting. Of the people who are eligible for a COVID booster this autumn, just under 64% of those in Wakefield have taken up the offer and had their vaccine. So while that's nearly 2/3, it does also mean about 1/3 of people who are eligible haven't taken up the offer. What we have seen in Wakefield is pretty much what I think has been expected across the country, which is that in care homes and the elderly, there's been really high uptake of the vaccine, but maybe in the younger age groups, people who've got a condition which puts them at higher risk, they've not necessarily been as keen to come forward and take up the vaccine. So we would encourage people, there's a little bit of time left, if you know anybody who could do with having it and hasn't yet taken up the offer, that there is still time. But do, as I said before in the answer to that previous question, try and get yourself into the rhythm of seeing that there's an invite, make your appointment and come along the same time as everyone else. And then we can hopefully deal with those spikes on the graphs that Stephen's been sharing. The other number that I was going to share with you, Steve commented that at the moment we're not seeing infection rates fall quite as quickly in the over 70s. It was just to reassure people that of those in that age group over 70 who are eligible for the booster, well over 88% in Wakefield have taken up that offer. So we actually have reasonably good coverage. But I mean, again, that is a group that is most vulnerable, most likely to end up in hospital. So if you do know anyone who's elderly who hasn't yet had their booster, do please encourage them to come and get that. And I'm sorry about the halo effect. The sun's obviously just come around to this side of the house. I hope it's not dazzling people.
The sun shines on the righteous.
It must be.
That's great. Thank you very much. Does anybody have any questions for Sarah? And I'm hoping you can all take yourselves off mute. I know people can put things in the chat, and you can always email me with any questions and I'll forward them on. I don't think we have any questions for you, Sarah, so thank you very much for that update. And I've just put the BBC summary up to load up, so I'll have a look at that as well. Thank you very much. Could we have the next slide, please? And Emma, I think you're going to talk us through this one.
Thank you, Tracy. Yeah, I just wanted to draw your attention to this great website, West Yorkshire Healthier Together. It's been developed by local healthcare professionals, and it helps families decide where to find advice and treatment for children and young people. It gives consistent, accurate and trustworthy healthcare advice to parents, carers, young people and professionals. And the information on the site has been reviewed by local paediatricians, GPs, community pharmacists, 0 to 19 years services and professionals across the region to ensure it aligns with current practices and procedures. It's a really, really great website. And one thing I also wanted to mention, I haven't put it on the slide, but we've translated our winter wellness booklet into an easy read format now. So I'll put the link in the chat and you can find it. You can find the easy read version along with other translated versions there as well.
Thank you. Emma and I worked on some easy read, and it wasn't easy to do, was it, Emma?
No, it was difficult, but it was a really great learning experience, and it's quite interesting because sometimes the easy read version is a lot better to read than the more traditional version, so it is worth having a look at it.
Yeah, absolutely. Thank you very much. We've got a comment from Pam in the comments, but does anybody have any questions or comments for Emma, please, while she's on her slide? No,
I was just going to agree there with Pam. I think that's a really, really good point. It is disappointing.
Yeah, for those who might not be able to read the chat, I'll just read it out. It's most unfortunate that in many spheres there are influential people raising doubts about risks associated with vaccines, most unhelpful.
Yeah, I mean, we never in the vaccination programme pretend that there isn't a risk associated with getting vaccinated. And I think that's a bit of a shock to people to hear that. We know that people who have received the AstraZeneca vaccine, a very, very, very small number of people experience blood clotting. And we know that a very small number of young men in particular who've had the mRNA vaccine have had an adverse effect to do with, it's called myopathy. It's to do with an inflammation around the heart, although it's not been fatal. We never downplay that there is a risk. It's just that the risk is teeny tiny compared to the risk if you are infected with COVID itself. So it's never a case of there is no risk with vaccines, and it's really irresponsible when people kind of make out that that is what is causing the problem and that is what is causing deaths, when actually COVID itself is thousands of times more dangerous if you're unvaccinated than the actual vaccine. It's a question of balancing two risks. But yeah, thank you for that, Pam.
And it's true, Pam, people plant the seed of doubt, and you can do that for anything, can't you? And that's just really damaging. And that's why we really value our COVID champions, because you'll know where to find information, and you know that you can ask challenging questions. You can ask them privately and we will always answer. We strive to do our best to be honest and open with you and answer questions as good as we can. And I think we've been really good at being open and doing that. So that's why we value the champions, because they can help to share those important messages. And those seeds of doubt you can plant for anything, anywhere, anytime, can't you? And they're just doing it to damage, and that's a shame. Thank you very much. I think that might be our last slide. Jenny, is it? Can you just check? Just to say that the next meeting is in February. And as always, you can submit comments or questions, but I'll just pause there and see if there's anybody else that would like to ask a question or comment. No, I don't think so. Everybody happy? Oh, and just a quick reminder that we do have some thermometers left. I know that Pam mentioned it at a previous meeting. We were speaking about winter wellness and that some older people, people who are poorly and people with young families, you know, young children in the families, might need to keep their homes a little bit warmer. So there's a thermometer that tells people what a safe temperature is. So if you're worried about somebody at home who might be old and saying, well, you know, I can manage, it's freezing in the house, but I can manage, it's a good way to encourage them that actually your health and well-being is very important. And if you're struggling with your bills, we've got Ben Oldham on the call. He's doing lots of work in different spheres to help people to pay the bills, but your health comes first. Please do keep warm. I think that's all then. Thank you very much, everybody, for attending. Thank you for all the work that you're doing, keeping everybody safe and well informed. And we'll see you in February. Thank you. Bye.
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 Bye.